So in my talk, I will present the potential of using digital tools that can change screening. And the most obvious tool today is the use of artificial intelligence. It's such a big and prolific field, and there's such an intense research going on, trying to solve many problems that we have in screening today. And one of the problems is that we want to detect more relevant cancers early. And that can be a challenge with the current methods that we use. And we can then use AI to predict the risk of cancer, but also to use it as detection support. So these two applications, determining the risk and the use of AI as detection support, there are several very interesting studies going on and also being published. When it comes to risk prediction, we have seen that when you add imaging-based parameters, you can improve the traditional risk models that you have. And that can then be used to adapt your screening program as a risk-based screening approach. And so far, there's been one randomized controlled trial where they used an AI-derived risk prediction model to identify women that can then undergo supplemental MRI imaging. And that was a Swedish study, the ScreenTrustMRI study. And what they found is that after a negative screening mammogram, when you add MRI, you could detect more cancers. So that's a very interesting development. But there are still some questions that need to be addressed because not all women want to undergo MRI, and it's also the question of the cost of using MRI in the screening program. But then we have mammography screening, which is a widely acceptable screening method that's recommended in our European screening guidelines. And it's a very good method, but it can be better. And there's been a lot of studies that have shown the potential of AI analyzing mammograms. And during the last couple of years, I've conducted a randomized controlled trial called the MASAI trial, mammography screening with artificial intelligence, where we wanted to see if we can apply AI to improve the efficacy of the screening program, but also to reduce the workload for radiologists. And this study was conducted in Sweden with 106,000 women. And so far, we have published 2 results from this study. And we can see that it's safe to screen with AI in mammography screening. So even if we reduce the workload for radiologists, we do not detect fewer cancers. And in a recent publication in Lancet Digital Health, we can see that when we add AI, we can actually improve the cancer detection rate quite dramatically. So we detect 29% more cancers without increasing false positives, which is a really important issue because we need to have a good balance between sensitivity and specificity in screening. And then it was also the question, do we detect the relevant cancers? And what we could see in our study was that the majority of the extra cancers that we detected using AI, they were mostly invasive cancers. They were small and they were lymph node negative. And also when we check the subtype of cancer, we can see that we not only detect more luminal A cancers, we also detect more HER2-positive luminal B and triple-negative breast cancer. So these results are very strong. And also at the same time, we can reduce the workload. And since breast radiologists, it's a workforce shortage in this discipline. This is something that is welcomed by the discipline. So we can already now see that AI is being implemented in many screening programs, especially in the Nordic countries, where it's starting to get implemented almost on in the whole country.